We're here this afternoon to make important announcements about public health and vaccine availability in Massachusetts. I'm delighted to be joined by Lieutenant Governor Kim Driscoll, our Secretary of Health and Human Services, Kiame Mahaniah, Dr. Robbie Goldstein, our Commissioner of Public Health, Commissioner Mike Caljouw of the Division of Insurance, Undersecretary of MassHealth Mike Levine, Matt Vino, Executive Director of Group Insurance Commission. We also have from the legislature our House Chair Marjorie of the Public Health Committee. Thank you for your partnership, as well as Representative Lon, Chair of the Healthcare Financing Committee, and Representative Cairns, Vice Chair of Public Health. We're also joined today by leaders from across our terrific healthcare system here in Massachusetts. Laura Pellegrini of the Mass Association of Health Plans, Dr. Ben Krusko of the Blue Cross Blue Shield of Massachusetts, Ryan Abrams, the Massachusetts Pharmacists Association, Val Fleischman and Steve Walsh, Massachusetts Health and Hospital Association, Dr. Olivia Liao of the Massachusetts Medical Society, Kristen Lewis of Point 32 Health, Carlene Pavlos, Massachusetts Public Health Alliance, Walter Ramos, Leading Edge, Massachusetts, Amy Rosenthal of Healthcare for All. I also want to recognize Rich Davey for Massport. Massachusetts has the best healthcare in the country. We do. Massachusetts, we have the best healthcare in the country. We have some of the best hospitals. Our scientists develop vaccines and medicines that save lives around the world. More people in Massachusetts get life-saving treatments, medications, and vaccines than any other state. People in Massachusetts are healthier than people in nearly every other state. And that's because we believe that healthcare is a right and public health is a responsibility. We've built a strong public health system, as you can see from everybody standing alongside me here today. This is a strong public health system that's backed by science that gets people the health care that they need. Now, historically, we know the federal government has been a partner in this work. Unfortunately, that is not what is happening in Washington. Under the Trump administration, the CDC has been hijacked by people like Robert Kennedy, people who don't believe in science, and people who don't believe in science-based healthcare. As a result, the government is failing its responsibility to Americans, including Bay-Staters. So we're here to say this is not going to happen in Massachusetts. In Massachusetts, we will not let Donald Trump or Robert Kennedy get in the way of patients and the care and the treatments and the medication that they want and need. So today I'm announcing several steps to make sure that that happens, to make sure that people get the medication and the vaccines that they want and need. So here's what we're doing. First of all, this is something that no state has yet done. Insurance plans in Massachusetts will continue to cover the vaccines recommended by the Massachusetts Department of Public Health, regardless of what any other federal agency or appointee says. This requirement has now been formalized in a joint bulletin issued by the State Division of Insurance and the Department of Public Health. It will cover the full range of recommended vaccines, including flu, COVID, as well as children's vaccines like measles, mumps, rubella, chickenpox, and more. As kids head back to school, and many of our kids headed back to school this week, we want to make sure that they can get the immunizations that they need to stay healthy, as well as our teachers and our families. Our insurance plans are here today. They are here today, supportive, and I want to thank them for their presence and for implementing this work as we move forward. I also want to thank MassHealth and GIC, which is the plan that covers many public employees, for taking the same step to make sure that people are covered. Bottom line, no one in the great state of Massachusetts is going to be denied because of cost. No one. Second, in Massachusetts, CVS, Walgreens, and other pharmacies will continue to schedule and give vaccines, including for the flu and COVID. Now, last Friday, Commissioner Goldstein, at my direction, issued a standing order that ensures that pharmacies can provide a COVID vaccine to anyone who wants it. Essentially, what this means, and the commissioner is a doctor, he wrote a prescription for every Massachusetts resident that covers everyone in this state. In addition, this morning DPH updated its policy so that the commissioner and not the CDC will determine which vaccines can be administered by pharmacists in Massachusetts. I want to be clear about this because I know there is concern. People have been calling pharmacies and not able to get appointments because of changes made by the Trump administration. That changes today, at least in Massachusetts. Because of what we're announcing today, starting tomorrow, pharmacists will be scheduling appointments and giving vaccines approved by the commissioner, and as I say, that's going to start tomorrow. All right, we were just finalizing it, but that's tomorrow. It goes into effect. Pharmacists will be scheduling appointments and administering vaccines approved by the commissioner. I'm grateful to CVS, to Walgreens, and our pharmacies for their communication and their collaboration to make sure this happened quickly over the past week. Third, moving forward, we will do whatever it takes to protect the health of people here and across the country. And that is why I'm announcing that we're forming a public health collaboration with states in New England and across the Northeast. We have been working on this for some time now. We will lead in the development of a few things. First, recommendations for safe, science-backed vaccines that patients, doctors, pharmacists, and health plans can rely on. Second, we'll work to protect and sustain our public health labs, our disease monitoring, our surveillance, and our emergency preparedness. We'll have more to say about this shortly as we move forward, but rest assured, wherever the federal government has created a devastating and harmful gap, we will look to do everything we can to protect the public health of residents in Massachusetts and work with our sister states to stand up and fight for and protect the public health of Americans. People here will continue to get the care and the protection that they need. It's a pretty sad statement that we can no longer trust the federal government on this, but sadly, that's where we're at. We've already seen more than 1 million cut from critical immunization funding, the loss of funding for asthma prevention and education, restrictions on funding for substance use disorder, HIV prevention and treatment, threats and attempts to cut hundreds of millions of dollars more in public health funding, threats to roll back access to reproductive health care, and that's on top of all the cuts that have already been made to food, to health care, to housing, to medical research that are hurting children, hurting seniors, hurting families, hurting public health of Americans across this country. So Massachusetts, we're not going to let this stand. We are taking a stand. We are a healthcare leader, and we're not going to let the Trump administration or Robert Kennedy cost lives and take us down when others fail to do their job. And that is what is happening right now in the federal government. And by the way, to anyone who supported Robert Kennedy in his nomination, what did you think was going to happen, folks? Okay? So to those who had the opportunity to stop this from happening, shame on you. And to Republicans or any other politician or anyone running for office out there, if you don't take this moment to step up and support public health, there is nothing more core that we do in government than to look out for the health, the safety, the well-being of our residents, our communities, our states. You saw the testimony this morning from our purported United States Secretary of Health and Human Services. It's despicable, it's shameful, it's not right. But I am proud to be governor of a state with great healthcare leaders and a state that's always valued investments, not just in healthcare, but in public health. Because I believe as governor that public health is a responsibility. I'd now like to invite up Commissioner Goldstein. I want to thank Commissioner Goldstein as well as DPH Chief of Staff Emily Daly for the incredible work that they did alongside Gabe Viator, my senior advisor, in making sure that we had a right and ready response to the dereliction of duty by Secretary Kennedy and the federal administration.
Good afternoon, everyone. I want to start by thanking Governor Healey for her bold leadership at what has turned out to be an incredibly difficult and complex time for public health, a moment when public health is being undermined by partisanship and by ideology. Despite the headwinds that we face, Massachusetts is charting a different course, one that's rooted in science, evidence, and a deeply held responsibility to protect the health and safety of our residents and communities. I'm speaking to you today as the Commissioner of Public Health for this state. I'm also speaking as an infectious disease physician who continues to care for patients. I speak to you as someone who spent 2 years during the COVID pandemic at CDC. And there, I worked alongside some of the brightest, most dedicated scientific minds in this nation. People who devoted their careers to saving lives and preventing disease. Last week, sadly, some of those most highly regarded CDC leaders resigned from their roles. They were compelled to leave by political pressure and attacks on their integrity. These are leaders who could not and would not compromise science for ideology. Their resignations were not quiet departures. They were declarations. They were loud and clear and powerful, and they said that science must guide public health. Their departure comes after months of resignations, forced firings, and leaves at the department. The people who are no longer at CDC are exactly the individuals we should want making public health decisions in the best interest of this country. They're the people who have earned and deserve our trust. They are heroes. Here in Massachusetts, that same commitment to science that these dedicated leaders represent is what we'll fight for and what we'll preserve. I say this all the time, but vaccines are the greatest public health advance of our time. They prevent illness, they prevent suffering, they prevent death. To restrict access to vaccines is reckless. To play politics with vaccines is dangerous. And our state will not bend to the partisan decisions made in Washington that are putting our communities at risk. That's why today the Department of Public Health stands shoulder to shoulder with the Division of Insurance, requiring that insurers in Massachusetts cover vaccines recommended by DPH, even if federal recommendations place troubling restrictions on vaccine access. People in Massachusetts will continue to have the ability to get these life-saving vaccines no matter what happens at the federal level. We also want vaccine access to be easy and to be readily available. We all remember the power of our pharmacists during the COVID-19 pandemic. Hundreds of millions of doses of vaccine were administered across the nation because pharmacists were trusted, accessible, and ready to step up to do what was necessary to turn back the viral enemy. Last week, I was honored and I was humbled to issue a standing order that empowered all qualified pharmacy personnel in Massachusetts to dispense and administer COVID-19 vaccines to all eligible individuals in the state. Today, we can reaffirm our commitment to pharmacists as essential partners in protecting lives. They deserve that trust, and our residents deserved that access. We're anticipating additional action at the federal level. CDC is convening its advisory committee in the middle of September, and they've signaled that they'll announce vaccine recommendations at that time. While we hope that their process will utilize a thorough review of the safety and effectiveness of vaccines, DPH is prepared to move quickly to provide clear communication, reduce confusion, and maintain access to these vital protections. By the end of this month, we'll issue updated guidance, along with our colleagues across the Northeast, for the 2025-2026 respiratory illness season. The guidance will center the data. It will be in alignment with the recommendations of trusted professionals, and most importantly, it will be driven not by partisan ideology and not by firmly held false beliefs. Massachusetts will not retreat from science. We will not retreat from the evidence and the data and the technology that have demonstrated the life-saving value of vaccines again and again, and will not retreat from our responsibility to protect public health. Because here we believe that protecting public health is not optional. It's a covenant with every child, every parent, every grandparent, every resident of our state. It's a promise that we fully intend to uphold. Thank you, and I will pass it back to the governor.
Thank you. Thanks so much, Commissioner, and thank you for your service. You heard his resume, right? That's who you want in charge of public health, okay? That's who you have in Massachusetts, and I'm glad about that. And I'm glad we're able to take these actions today. And again, I want to thank all the partners up here, and it really reflects all the partners, all the stakeholders. This is as broad an array as you'll ever see when it comes to healthcare in Massachusetts or anywhere in the country. And I think it says something about our collective commitment to making sure that people have access to the care that they need, including the treatments they need, including the vaccines that they need and want. We're happy to take any questions on topic.
Perhaps Commissioner Goldstein can specify, starting tomorrow, can everyone in Massachusetts sign up to get a COVID vaccine? Or is it just for the groups that you're recommending, and which are those groups?
So starting tomorrow, CVS and Walgreens will open up their portal for folks to schedule an appointment online. And they'll go through, and the portal will ask some questions about who you are, and you attest to some of those questions. Once you've gone through, you'll be able to schedule the appointment. Anyone who's eligible has the ability to get the vaccine in a CVS or a Walgreens or any pharmacy tomorrow.
But can you specify who is eligible? Are you recommending it for everyone or just certain parts of the population?
So right now, as I said, we have not put out recommendations for the 2025-2026 season. We still have our active recommendations for 2024-2025. And those recommendations say that anyone 6 months and older is eligible for a COVID vaccine. And we would recommend, if someone wants to get it right now, they look to those eligibility criteria.
Governor, Massachusetts has its own vaccine recommendations, and so do 49 other states. How do everyday people know which recommendations to trust?
Well, I'll let you speak to this, but you can trust, if you're in Massachusetts, you can trust the recommendations of your Department of Public Health. That's because your Department of Public Health believes in science, believes in data, believes that science and data and study should drive recommendations and guidelines, especially when it comes to public health.
Yeah, I'll just add that, as you've heard, we are pushing forward with a regionalization, a collaboration across the Northeast, because you shouldn't have different recommendations if you live in Rhode Island, Connecticut, and Massachusetts. And so we're committed as regional public health to come out with unified recommendations about who's eligible for a COVID vaccine, how do we communicate about that eligibility, and how do we make sure we protect the most vulnerable.
And remember, we're forced to do this as states because of the abdication of responsibility by the federal government. And so we've worked quickly here in Massachusetts. We've worked with other states. We're going to invite other states to join our coalition so that there is more of a consensus, which I think there will be, because I think, fortunately, a lot of governors and a lot of folks in a lot of states believe in science and believe in data and believe that that should drive healthcare, our innovation, and the kinds of treatments, cures, and things like vaccines that are out there available to our residents.
If I can just add, I'm going to add one thing on these recommendations. So I think many folks know about the Vaccine Integrity Project, which is putting out data to help all the states make these decisions. And we're also working closely with the national professional societies, the American Association of Pediatrics, the the American College of Obstetricians and Gynecologists, the American College of Physicians, and the Infectious Disease Society of America. Those are national bodies made up of experts in the field who are going to look through the data and make recommendations. And we're going to lean heavily on those, and we hope other parts of the country will join us.
You talked a lot about vaccine access. What about vaccine requirements? There's some feeling that some people that went too far in COVID at points and had to be rolled back. And now there's talk about the school requirements of vaccines.
Look, this is about freedom. And I'll be really clear with you. My view, and I've heard from a lot of people, including a lot of parents who've been pretty freaked out lately about, what does this mean for my kids, Were you immunized when you were little? I think a lot of us were used to, when we were little, you get that MMR shot, right? You get that shot, for chickenpox. These are things that we do as a matter of public health and have done as a matter of public health across this country for a long time. What we are doing is making sure that people still have the freedom to take advantage of that and avail themselves of those vaccines. I'll also say this, the programs and the requirements out there have been and continue to be backed by science. There are literally, and Robbie, you'll correct me if I'm wrong, Dr. Goldstein, hundreds and hundreds of studies that show the millions of lives that were saved by the COVID vaccine, right? You know, unfortunately, we've got a world-class conspiracy theorist who has made this his mission to take people in the American public down this crazy, zany rabbit hole of conspiracy when it comes to some of this stuff. And, you know, that's what's going on in D.C., but we're going to stay the course here in Massachusetts. And, you know, I want to make sure that, you know, if you're a parent, if you're a young person, if you're a person with compromised immunity, if you're somebody who's undergoing treatment for cancer, no matter who you are, if you want a vaccine, we're going to be able to provide it for you here in Massachusetts. And by the way, I'm also really proud as governor of this great state that during COVID, it was Massachusetts companies that developed, empowered, and produced and distributed COVID vaccines that saved lives around the world. Around the world. The president would do well to really remember that, as he was a COVID victim himself at one time. I think about the ingenuity, I think about the science, I think about the innovation, and so much of that powered right out of here in Massachusetts.
What about parent freedom to say no? What about parent freedom to say no?
Parent freedom? Look, our laws are clear on this in terms of the exemptions that people are allowed to get.
The administration decides that they did not want states like Massachusetts to chart their own course. Have you got any sign from them whether they're okay with Massachusetts doing this? Are there ways they could push back and pull you back aligned with CDC recommendations?
I have an obligation to take care of and look after the well-being and the public health of people in Massachusetts, and I will continue to uphold my responsibility and my constitutional duty.
Governor, how do you punch through that misinformation we were talking about? Commissioner Goldstein, is there any public education you can run through this? I mean, you can provide all of this. Figuratively lead people to water, but you can't make them do anything.
Today is about making sure that the many, many hundreds of thousands of people across Massachusetts who have already reached out, scared about the White House announcements, scared about the total dismantling of the CDC and what this means, upset that they're not able to get vaccines, not able to make appointments. Today's action is for them, making sure that people have access to the vaccine that they need and that their family members need.
And the people who aren't sold, I mean,
Yeah, maybe I can jump in and just say, we can put out a ton of information from the Department of Public Health and from state government, and we will do so, and we will speak truth to the power of vaccines. But many of these decisions happen at the local level, and they happen in one-on-one conversations. And that's why on this stage, we have true partners. We have Mass Medical Society representing the physicians who are having the hard conversations in the exam room every single day. We have Mass Public Health Alliance that works with every local board of health to make sure that public health practitioners in the field can talk about the power of vaccines. We have Healthcare for All that goes door to door and tells people about the power of vaccines. This is going to come down to every person doing their part to make sure that we get the truth out there.
Commissioner, can you talk about how this guidance will be issued, if it will be voted on by the Public Health Council, by the Vaccine Distribution Committee? How will it be kind of vetted?
So we have many ways in which we can vet this information. We have, as many folks know, a Massachusetts Vaccine Purchasing Advisory Committee. We can use that committee, and we will use that committee to look through the recommendations and make sure that they're evidence-based. We've done that historically for pediatric vaccines. The regional group is also coming together, and that's made up of public health practitioners from across the Northeast. Those are true experts in this. They're also going to look through everything. And then we have our professional societies, both based here in Massachusetts and nationally, and we'll work with all of them.
who will have the final say on this? Which of those groups will you have the final say? Will there be a vote among the states?
Well, here in Massachusetts, I will have the final say as the Commissioner of Public Health for this state. That's my responsibility. But our goal is that we align all across the region so that people aren't confused when they're driving between Massachusetts and Pennsylvania and thinking through what vaccines they could receive.
Governor, can you clarify, this is separate from the legislation that you filed, seeking to give the commissioners a vaccine authority?
You want to speak to
Yeah,
that?
I'm happy to speak to that, yes. So I think you're referencing some legislation that the governor proposed over July and August. That's specifically about our Pediatric Vaccine Purchasing Advisory Committee. That group historically has been tied to CDC, to the Advisory Committee on Immunization Practices. And the legislation which passed and was signed allows us to turn instead to the commissioner and to the advisors around me to make the right recommendations for pediatric vaccines.
Governor, what's your take on Florida? Governor, what's your take on Florida and their school vaccine? Did they scrap the requirement?
I think it's crazy. I think Ron DeSantis is putting politics over public health. I think a lot of people are going to think twice about going to Florida. I don't think measles was a souvenir that you were looking to return with after a trip to Disney World. That's what I think. Welcome to Massachusetts as we celebrate 250 great years, by the way, of freedom. And I believe that people in this country deserve the freedom to make healthcare decisions for themselves. That is my story. I'm sticking to it. And, you know, it's just really shameful what's going on in D.C., especially, you know, I hope you guys saw today. I mean, we saw Republicans who shouldn't have voted for him in the first place taking Kennedy to task, right, and calling him out, including Republicans with medical degrees behind them. So this isn't, I'm not about playing politics. This is about public health, and this is about our responsibility as states and those of us privileged to serve to make sure that we're doing right by people. And one of the most basic things you can do for people in your state, make sure they get food, make sure they have access to housing, make sure that their community's safe and protected, and make sure that they get the health care that they need. And I sure hope, you know, for all the little kids out there, whether they're in Florida or Texas, I hear others are contemplating similar bans. You know, look at the outbreak we saw in the Southwest earlier this year, okay? You know, it just doesn't make any sense. And it just continues to be an example of the destruction and the perpetuation of harm, promulgated through misinformation, disinformation, defunding, and all sorts of things that just reflect, you know, it seems this effort to push ideology and politics over public health. It blows my mind. I can't imagine as a governor ever doing something like Ron DeSantis did that puts people in harm's way. And that's what that does.